My name is Lauren Fields. I'm the Chief Nursing Officer here at ARcare. I've been with ARcare for coming up 8 years, and I started out in the Coordinated Care Division and then have just evolved as the job evolved. So in 2018, ARcare and the Extension Service partnered on a project we call the Warehouse. The Warehouse began in the rural community of McCroy, and we were able to provide a food distribution site to those community members, along with a registered dietitian who assisted in healthy cooking demonstrations. That was made possible because of the extension services. Over the next few months as the warehouse grew, we were able to bring in partners such as the diabetic shop, who provided shoes for those who needed it. We brought in clinical staff to do blood pressure checks, provide flu vaccines. And so that partnership was very strong from the warehouse. It also expanded into another community in Parkin. So in 2020, after the pandemic began, we came back to the table with Extension Services and we partnered on the Excite project. And that project was focused on vaccinating rural community members. So with that project, ARcare has been the boots on the ground as a partner with Extension Services. And we've had nurses that were there. They showed up at baseball fields to vaccinate community members there. Our team has brought the mobile unit in, and we've done vaccinations with the mobile unit. We've just tried to assist the Extension Service in any way that we could. They've been so good to get the word out, to advertise, and to be there with us, and we've brought in the clinical staff for the most part to give the vaccinations. I think the impact of that partnership has been that we've been able to vaccinate members of communities that otherwise wouldn't have had access to that care. Along with the COVID vaccines, we've been able to give flu vaccinations, pneumonia vaccinations, and then that evolved into all adult vaccines. So I think we've seen the trickle-down effect of being able to be in that community, offer the COVID vaccine. That's allowed us to offer even further vaccines to those patients. Our partnership continues to grow. We've seen that since 2018 when we started in one county, and over the last 4 years it's evolved into multiple counties across the state. And I think that will only continue, and that we'll partner on more projects. You know, we've covered everything from providing food in communities to providing vaccinations for those communities. So I'm excited to see where that goes in the future. ARcare appreciates the partnership with Extension Services. I think it allows us to be out in the community more. Our main work is in our clinics, and it allows us an opportunity to be a part of those community events, to get our name out there for people in those rural communities. And that's really what we want to do and what we do. You know, Dr. Collier always says we have health for all, and the partnership with the Extension Service has allowed us to provide that health for all.